Jim's number yesterday at some pizza place, so good luck. Ordered 200 pizzas though, Jim, so watch for that bill coming. So I'm Dr. Gary Lee, this is Dr. Rob Tomahawk. Combined a little over 50 years of experience in the chiropractic community. I practiced my whole career here in Utah. Dr. Rob is a transplant from California. Ran a clinic, 10,000 square feet. Did how many services per week?
3,000 procedures a month.
3,000 procedures.
Not all chiropractic.
Did a lot of stuff. Probably one of the most educated chiropractors I've ever met. Okay, wealth of knowledge. So I don't know if you know me. I've been around a long time. I started delving deeper into things about 6 years ago after I was kind of set on fire by Evan Katz. Is that name? Evan Katz? No. Runs a website. Does some publishing. Anyway, he sat at a seminar and he said, look, if you guys don't listen to what I'm saying today, in about 3 years, you're not going to get paid anymore. I started writing down. And I wrote down every word that came from that guy's mouth. I had writer's cramp so bad after 2 hours, I couldn't believe it. He took a break. I looked around the room expecting everyone to have the level of interest that I did. Guess what? Right? They didn't have the level of interest that I did. I'm writing down everything that I write down. So that set me on a path of reading more research, of finding out and learning about things I didn't know about. That led me to doing expert witness work for the last 3 years, which I've been publishing, and then it led also to my relationship with Dr. Tomahawk and Modern Health U. Who knows what Modern Health U is? Have you ever heard of it? We're new. Okay, we're a medical diagnostic company. All those diagnostic tests that chiropractors don't want to do, can't afford to do, don't want to take the time to do, that kills your case because you don't have it, we do it. And we provide a report with over 300 peer-reviewed journal articles that support the tests and the results that we did. Right? So if you have a case that needs evidence, is there a case that doesn't need evidence? I mean, what do you guys do? You're a doctor, you're a chiropractor, what do you do? I understand you treat patients. But if it's personal injury and you're working with an attorney, you are the evidence gatherer. You need to gather the right evidence that makes it easy for the attorney to get a case done with amounts that pay the doctor, pay the bills, and provide future care for the patient. So, based on research, because we deal a lot of research, right? How many, let's do a percentage. What percentage of people who have been injured in a car accident don't get better and go under chronic pain? What do you think?
For the rest of their life. In 2 years, it's 25%.
That don't get better? So we've got research that says 50 to 80. 50 to 80% do not get better. In the first year, over 75% report that they are getting better, but by year 5, the pain has regressed, the symptoms have worsened, they've become chronic and are now worse than what they were after the accident. That's 5-year follow-up tests. Okay.
Statistics also show that there's 100 million Americans that suffer with chronic pain, with a direct correlation because of the car crash. So there's what, 350 million people in the country? So 100 million. 3 or 4 is next. Started with drug addiction because of pain. They said that's the majority of the reason. They said, well, what was the main cause? And overwhelmingly, they calculated that it was 90% of their clients ended up with drug addiction because of pain from a car crash. It's a pretty crazy stat, right? So the whole fentanyl epidemic coming from car crashes, that's a major factor.
So are we getting the job done? Are we getting our patients better? Apparently not. Short term, maybe so. Long term, maybe not, right? So statistics for me are important to look at because nobody is really better than the statistics. And the study we're talking about that shows large numbers not getting better at the 5-year point, that's not chiropractic here in Utah. That's in general worldwide. So I don't care what kind of doctor you are, whatever approaches we're using for diagnostics and treatment are not providing long-term outcomes. So we got to do better. We got to get smarter. There are reasons people don't get better. And a lot of those reasons we should know up front, not down the road. What does an attorney do when he's got a case that doesn't have good support? He hires an expert witness, I know because I did that for 3 years, right? To try to figure it out, find a place to hang his hat so he can go to the insurance company and say, but we didn't tell you, but we found this in the records and now we have a case. That's not the way it should happen. We should know that stuff up front, and we should be screaming it as loud as we can. Day one, initial report, insurance company, I found these things, which means that this patient may not get better. There's a high possibility of transition to chronic pain. You should use that term, transition to chronic pain. And therefore, we're going to treat in this manner, but we'll be doing follow-up testing to find out whether or not the patient got better. Possibility of future care. Okay? Now, I usually say buckle up because we're going to go over a lot of stuff tonight. It's stuff that he and I have gathered not only during a career, but over the last 3 years of intense study, tracking down information, finding information. Seems like every time we open a door, I can't close the door. We have to walk through it and learn this stuff. And it changes everything. It's been crazy.
I'm not just going to chiropractic seminars, going to legal seminars, going to ODG seminars, which the insurance company uses, going to insurance seminars, seeing what they're doing, find what we're trying to do. Trying to get a global perspective of like, what do they do on their side to screw us? So let's go pay attention to them. Hire your reporter, not tell them who you are, gather that information. Right? How are attorneys handling cases? We've had conversations with orthopedic surgeons, neurologists, medical doctors, mental health specialists, right? PTSD specialists. We want to understand how the whole game plays together, so that way you guys can be the global overseer of the case and then determine, what do I want to take care of? But yet, this person over here has another problem. Can I also refer there? Instead of having mono treatments, right? Let's do a collaborative approach.
So when we talk about things like evidence-based diagnostics, right? And I made a statement, forgive me, I don't mean to offend anybody, but I'm a chiropractor too, and I don't want to take 2 hours in an initial exam. I don't want to buy $100,000 worth of equipment that I use on my initial day in order to do the testing so I understand the patient. It's like, I got work to do. I run a practice, right?
$200,000, by the way.
So we spend 200 grand on equipment. Do you want to do that? I don't know many that do, okay? So, you put it together. You start to understand why it is people aren't getting better. And then you start looking for those indicators. And then you put it in your notes, right? At the end of the day, an attorney has to have evidence, guys, evidence, okay? Leadership from real practitioners. I mean, we've done it. We've done it. Experts in every field. We've gathered it, okay?
And we've had our bills cut. We've gotten no bills paid, right? And why are you cutting my bill? I did the right thing. Why are you slashing my bill by 70% or 50%, right? Like, why is that? We had no idea why. And so you dig into this whole cycle of understanding, and unfortunately, in the PI world, we're down here. Okay? What we're doing is up here, but how they value us is not. So we need help.
Okay. How many of you have had one of your patient cases go to an IME? Forgive me, Section 35. I don't care what they call it, right? Have you ever read the IME letter? One? You never had an IME? Man, you're living a good life. Did you ever read the IME they came back with?
Yeah, I used to write it.
You used to write them? For whose side? You don't have to answer that. So, you get the IME back, and it gives lots of opinions that basically are saying what? Oh, come on, the patient wasn't hurt. The accident didn't cause that much damage. The patient doesn't need any more treatment. Frankly, the treatment he received probably isn't really worth it, but I'll tell you what, we'll pay a percentage of it. I mean, it's right. And what is it based on? What is it based on, guys? Personal opinion. I've had big name IME doctors write in their report, I believe that the AMA guides say, and then they lied right through it. They didn't even quote the AMA guides. They lied. Okay? It's never published. They make it up and they give personal opinion. Do you know that? So if you include your opinion with notes, or excuse me, with published research, what did you just do? You provided refutable or irrefutable evidence to your attorney of what you're doing. So you got to be reading studies. You got to include studies that support your diagnostics and your treatment so that the attorney can do what he needs to do. And I've done 100 of them.
Or we just do that.
Or we just do that, okay? I've done 100, and many of those included refutal or rebuttal of the IME doctor. It's always personal opinion. It's never backed by research. And if they rebut my rebuttal, they'll go out and find 1 or 2 research articles, crappy, most of them are refuted anyway, and then try to say, well, I included a couple of research articles. I've got over 200. Are you kidding me? And you bring 2 to the table? Everybody starts at the same level. If you're giving an expert opinion, do you understand it doesn't matter if you're a medical doctor, an orthopedic surgeon, neurosurgeon, you're all starting at the bottom rung. The only thing that makes your opinion any more valuable is the research, the evidence that you bring with you that you're right, which is going to show what about them? They're wrong. Irrefutable. They don't bring anything to the table, you're going to eat their lunch. Okay?
So this is kind of like the one phrase that I base my 20-year profession on, right? Because as a person that owns a business, we still have to sell a product. So what are we selling to the patient, right? My background was in PT, personal training. You get a client in, they have a goal. What's the purpose of them seeing you? How do you get to that goal? So if they're seeing you and you're never increasing their muscle mass or decreasing their body fat, will they stay with you? So in our profession, what's the goal? To get them feeling better? Well, they have thousands of options when it comes to that, from alcohol to PT to chiro to medication. What's our product? So when I took a look at what's manifesting and creating pain, you look at the 4 pillars: muscle, nerve, bone, connective tissue. So if I could objectively analyze those 4 causes and then have a therapy for those causes, reevaluate those causes, validate the improvement by doing an objective progress evaluation, then I have a product. And if I can do that within a certain time frame, now I've captured that patient because now I've had success. And I've proven to them that I've created a successful program, not just based upon how they feel, but why they feel that way. So everything that we do is either subjective or objective. We gather data, we look at it, we make recommendations on care. You guys do what you do. They come back, we do a progress follow-up, do a comparative study. At the end of the case, we do a pre and post. And if things aren't back to where they're supposed to be in the ideal situation, now the attorney says, patient is still having pathology, objective analysis, they haven't gotten to the point of full correction, right, MMI. So now we're recommending X treatments for A, B, C, D, E, F, G. And that's how we establish a credentialed value when it comes to futures. Not just a guess or my opinion. It's coming from objective information, plus research, plus how much more do they need. And that always includes chiropractic, right? So the process is 90 days. How far along are they for 90 days? And how much more do they need chiropractic? So we're not wasting all their money throughout the entire process. Like we've worked with cases where we've gotten them to a $1 million policy, and the attorney has said, go ahead, go ahead, go ahead. And they've actually spent $1 million on their care, and now they have no money left.
And then you get the phone call, right? The phone call. Doc, you're going to have to reduce your bill. But you did your job, right? Forgive me for interrupting. Anyway, what are AMA guides for translational instability? 3.5 millimeters, right? Rotational instability, 11 degrees. Is instability, ligament instability, a big deal?
Yeah.
It's the biggest deal. That outweighs everything.
Why is it the biggest deal? What?
Ligament laxity is a permanent impairment.
But then how do you also validate that it was caused by a car crash? But how do you know it's pre-existing?
You need to review their medical records.
Good. So now we're building that story, right? It's not
Yeah.
just I have AMSI, right? There's a story behind this. We have to have spine pathology, the functional assessment, and quality of life. Because if you have a ligament stability that's not causing a functional impairment, that's not affecting their quality of life, this ligament stability is irrelevant.
Right? What does Bonner research tell us about translational instability? Is it 3.5? 2 millimeters or more. It's not 3.5, that's AMA guides for disability. True
Guidelines.
ligament instability is 2 millimeters or more translational in either direction, or 11 degrees rotational. If you measure it, then you can use it to increase the value of your case and your treatment, right? And use it to get paid on top of that.
You did a functional MRI or MRI or X-ray?
We're doing flexion extension X-ray, DMX, and flexion extension MRI.
We'll get to that.
We're going after the whole body. Okay? Oh, you want to do this one? You want me to do this one?
Talk about the B4s.
The B4s?
And how we got
I
there.
can't see that far up.
Injury inventory.
Injury inventory. All right, so if you looked at ideally, if you said, I would like to create a questionnaire and then an examination to cover all the bases I've ever dreamed of. That'd be pretty long, wouldn't it? That'd be a lot of stuff.
How do you even know how to get there? Like, what do you evaluate?
So we did that, but it took us 3 years, right? So we will have a patient fill out a lengthy questionnaire that covers all the bases. But it's also covering bases that you as a chiropractor can cover, but there's no value to it. Why is that? Why is there something that you would do or put in your notes that has no value to an insurance company? Because you're a chiropractor. It requires an MD signature. So our inventory and report is signed off by a medical doctor. There's several reasons for that will come up, right? Go ahead.
So we've had
Body, brain.
conversations with different types of providers in the last 3 years. One thing that really caught our attention was a group out of Ottawa, Canada, that looks at the cognitive, psychological, emotional aspects of chiropractors and how it's tied together. No idea about this area, right? So now we've included PTSD, concussion, sleep, anxiety, depression questionnaires, right? And you start looking at the answers that your patients are giving you, because I've never asked those questions in my life, because I'm not a psychologist, right? But you've had a trauma, that might be important, because it is, and we've had that conversation. And you start getting those answers back from your patients, you're like, wow, no idea that was part of why they're not getting better, right? Behavioral problems, right, from the car crash, quality of life, not getting along with their husband, wife, can't do their job. Like, we just come in and we treat the physical aspects of it, but this is a problem. We're not even aware of it. But if we're understanding that concept, there's tons of diagnostic codes that are valuable for a personal injury case that the attorney can use. Then also, as a global perspective, you guys can now decide and have a conversation with the patient and say, hey, this is what we found here. I think we should recommend some mental health coaching, right? But you have to be able to evaluate that to determine if that's valuable in the case, have a conversation. But imagine the chiropractor, you've discovered that. That goes a long way, right? So we look at body, brain, behavior. Now we just started working with the University of Utah, BYU, and the neurobiology department, and understanding how blood biomarkers and concussion and emotional distress and chronic pain overlap one another. No idea. So now we're having these conversations where, like, they're talking and it sounds like Russian to me. So imagine encountering that situation, how to handle that. So now they've done research on PTSD and blood markers, PTSD and anxiety disorders. If you improve that biomarker, a person's PTSD and anxiety disorders starts to go away. Not in human model, but in mice models. So they want to work with us because if we're capturing that information, the behavioral aspect, plus capturing the biochemistry, and then we fix the spine, will it fix the biochemistry, potentially help with the PTSD? We don't know yet. That's kind of a cool concept. We're starting to work with other types of doctors, and we're overseeing as chiropractors. So So that's kind of where we're going with this.
Pretty cool stuff. At the end of the day, you want to improve care, right? But you want to increase case value so you can get paid and the patient can get what they need. You need to justify your treatment or it gets cut, and you need to help the attorney to settle. You think an attorney wants to deal with a case for 4 years, trying to battle an insurance company that just won't agree?
That costs some money.
Ton of time too. They don't want to do that. Okay. So we do the inventory, pain and performance. How is pain? How are the diagnostics affecting a patient's life? How are they able to perform their normal duties? Okay. Evaluation structure, mode, medical objective diagnostic evaluation. So we will go through a process of initial contact and interview, an MD interview. Then the patient shows up to the clinic for the in-person, face-to-face gathering of all the data. Okay. So one of the things that we found is that the great majority of places that will do a second opinion for you, right, want to hang their hat on one thing. We found a disc. Oh, we'll need to do a surgery. Oh, let's do some injections. But it's based on one thing, right? It's one thing, one diagnosis. Is there always just one diagnosis? As a matter of fact, majority of the time, is there just one diagnosis with the patient? Or is there more going on?
How often do you get notes back from those IMEs?
Well, usually you have to call and request it because they'll send it to the attorney, but they won't send it to you as the doctor.
So then you have no idea what your patient did, right? How many times did they go see the mid-level, the second opinion, and you said, here's all the documentation, and then what do they say? What brings you in today?
What brings you in today?
And the main problem that he's discovered is neck, limb instability, pathologies, and that given person's like, my wrist hurts, right?
Guess what they focus on? The wrist. All right? I mean, I've been around a long time. And I've believed these groups when they first open and they say, hey, we're patient-oriented. We're going to pay attention to the patient. We're going to take care of proper diagnostics. And that lasts about a couple of months.
For about a year.
Okay. What do you get back on your report, if you get it back, right? Usually by a mid-level who does a brief interview/examination.
Subjective. Pinch my finger.
Turn your head. Is that objective data? Nay. No. It has to be measurable and compared with normative data, right? You're not getting that. So what's their diagnosis list like?
Subjective. 4.
3, 4 diagnoses, 3. Cervical sprain, lumbar sprain, oh, lumbar disc or cervical disc, right? That's all you get.
For the year that I worked with a mid-level company, I was in charge of causality. The most diagnostic codes I saw was 6. The average was 4. 6. And they weren't pathology-based, they weren't objective-based. They're coming off an interview, and the documentation wasn't injury-based, right? They weren't providing certain pieces of key information that are necessary to drive in the case. So really, you got nothing out of it. The attorney spent $1,000, and on the occasion, don't go back to the chiropractor. You don't need that. Go do PT.
Thanks.
Like, what happened? I just said, I lost my client.
Appreciate the support there, buddy. Does that happen to you guys? Oh, come on. It's happened to all of us.
It has, sucks.
And that crap report you get back provided no value to your case, no value to your patient, and didn't help you at all. And yet we keep referring them.
And now it takes money out of your pocket.
Okay. Why would we want to have a medical doctor involved in that process to sign off on the report?
That's clout.
Okay, that's clout. Specifically in what way?
Because like you said earlier, there's things that we can't sign off on that they can't.
You're going to hate me. You're a chiropractor. I'm a chiropractor. How many injuries and how many symptoms can you put on your HICFA form legally that their AI is going to pay attention to?
8.
4 injury codes, 2 symptom codes. You get 6.
And
That's
how
it.
many do you need to open up additional value in the case?
10. You can't do it.
If you don't get to 10, there's no value to the case.
You can't do it. You've got to have an MD involved. So you refer to someplace who has that ability to put an MD level signature. It could be a mid-level, that's fine. MD signature, and instead of doing you the favor of properly diagnosing the case and coming up with sufficient diagnosis and injury codes to support your case, they come back with 3, maybe 4, but usually 3.
So even if they come back with 3 or 4, do you add those in your notes and say, now I'm treating all those 3, so now I have my 6 plus the 3? Do you add those to your notes? I'm saying I reviewed the medical documentation from I'm now also including these diagnostic codes in my paperwork, and now I'm treating this as well. You guys do that all?
Got to do it.
Yeah.
Got to do it.